Welcome to meeting number 37 of the House of Commons Standing Committee on Human Resources, Skills and Social Development and the Status of Persons with Disabilities. Today's meeting is taking place in a hybrid format pursuant to the House Order of January 25th, 2021. The proceedings will be made available via the House of Commons website. The webcast will always show the person speaking than of the committee. Pursuant to Standing Order 108 Sub 2 and the motion adopted by the committee on Tuesday, February 2nd, 2021, the committee will proceed to its study of the impact of COVID-19 on seniors. I'd like to welcome our witnesses to begin our discussion with 5 minutes of opening remarks, followed by questions. Appearing today as an individual, Dr. Veronique Boscart, Executive Dean, School of Health and Life Sciences at Conestoga College. From the Center of Aging, Dr. Michelle Porter, Professor and Director at the University of Manitoba. For the benefit of our witnesses, just a couple of other comments. Interpretation is available in this video conference. You have the choice at the bottom of your screen of either floor, English, or French. When speaking, please speak slowly and clearly. When you're not speaking, your mic should be on mute. We're going to start with Dr. Boscart for 5 minutes, please. Welcome to the committee. You have the floor.
Thank you. My name is Veronique Boscart. I'm going to start off with stating that I'm a registered nurse. I've been a registered nurse in long-term care for over 25 years, and I've worked throughout the COVID-19 pandemic in good and bad days. I'm also in my second 5-year term of the CIHR Schlegel Industrial Research Chair for Colleges and Seniors Care, which means that I hold a national research chair focusing on workforce, staffing, and training related for those caring for seniors in our country. And so within that portfolio, I conduct pragmatic intervention research to really optimize life and care for seniors and their families, both in long-term care as well as in retirement and in home care. I also hold the role of Executive Director at the Canadian Institute for Seniors Care. With that group, we developed tailored training for the future and existing workforce in seniors care. Most of our work is focused in Ontario. And then lastly, I'm the Executive Dean at the School of Health and Life Sciences at Conestoga. And there we focused on strategic mandate on optimizing education and training, as well as innovation and research for our healthcare providers. We are very committed to raise and bring into place a generation of healthcare providers that do recognize and can address the needs of our seniors and their care partners in our community. So I want to thank you for the opportunity to speak to you today on the needs of seniors in Canada. And as you are aware, seniors age 65 and plus are the fastest growing population, more likely to have chronic complex conditions, and they really and support from a healthcare team communities. And the COVID-19 pandemic had really highlighted the gaps in our care system. So I think, unfortunately, Canada is the country with the highest mortality rate in long-term care homes. And I myself can personally testify to the detriment effect that has had not only in our country, but on our workforce, our families, our loved ones, and our communities. So now more than ever is a time to critically reassess the design and the way we provide our services for seniors, as well as how we are educating the future workforce, as how we deliver current care practices to our seniors. And so there is many reports available on that. I'm happy to provide more detailed information and answering your questions, but there's never been a better time than now to actually really cause a change in our long-term care and healthcare system. I'm more than delighted to contribute further, and I pass it back on to the speaker. Thank you.
Thank you, Dr. Boscart. Next, we're going to hear from Dr. Porter for 5 minutes, please. Dr. Porter, you have the floor.
Thank you for the invitation to speak today. I'm the Director of the Centre on Aging at the University of Manitoba in Winnipeg. Our centre has existed since 1982 and is the focal point for research and knowledge mobilization on aging in Manitoba. The first issue I would like to discuss is access to information and services specific to the pandemic. One example here includes the fact that most resources, information, booking systems, etc., have relied on web-based systems. Whether it was finding about finding out about where testing locations were or when they could get vaccinated. This information is typically provided as a website. In the short term, we need to ensure that access to information is available through the phone as well. And phone numbers need to be highly publicized through COVID press conferences, for example. Because if you don't have access to the internet, how do you find the phone numbers? We applaud the federal government for providing funding to add a phone line to the Manitoba 211 services. This is a needed service in the short term. In the long term, we need to find ways that everyone has access to the internet. This requires physical infrastructure, but also requires that everyone can afford the equipment and services, regardless of where they live and what their income is. And access to internet is critical for long-term care as well. Wi-Fi in many homes did not exist or was not sufficient. So including this in standards for long-term care would be important. Every resident room and common room in a long-term care home should have good Wi-Fi. Another access issue that has been quite apparent is transportation. Age-friendly transportation and affordable resources are lacking in many locations, particularly intercommunity transportation. This has affected access to COVID testing and vaccinations. If aging in place is a goal for governments, then we have to ensure that communities are age-friendly in terms of transportation. One tragic story in Winnipeg occurred when a family had to pay for a stretcher service to bring their bedbound father to a vaccination site. An age-friendly community would find ways to ensure that the environment can enable that person to live in a non-institutional setting and still receive services. Another long-term care issue is related to quality of life. Clearly, there are not enough recreation staff in long-term care. And these workers, primarily women, who are key to resident quality of life, are often only able to find part-time and low-paid positions. We need to ensure that we think beyond the healthcare aspects of long-term care and provide much more in terms of social care, because these places are people's homes, not hospitals. Overall, we need to ensure that all workers in long-term care receive the training they need, as well as the respect that they deserve through proper compensation for their vital roles. As we build back, we need to focus on the care economy and ensuring that women from all backgrounds are not left behind. The final issue I would like to introduce is the consequence of sedentariness during the pandemic. Many older people have moved very little for many months. This has implications for risk of falling, health, and physical function. Post-pandemic, we will need to ensure that programming and services will be available to respond. For example, we know that an individualized approach is critical for falls prevention. However, in Winnipeg, we have lost universal access to adult outpatient therapies because these services are not part of the Canada Health Act. This means reliance on private health insurance or paying out of pocket. Similarly, access to therapy services is not sufficient within long-term care either, and residents have experienced a dramatic reduction in their physical activity. And of course, we cannot forget about all of the individuals who will need to recover from COVID. We need targeted federal funds for appropriate therapies and physical activity programming to allow individuals to recover their physical health. I would like to end by saying that the Government of Canada endorsed the Global Strategy and Action Plan on Aging and Health of the World Health Organization. 2020 saw the official launch of the Decade of Healthy Aging by the WHO. Canada needs to ensure that coming out of this pandemic, we are ensuring that older people are able to achieve good health in age-friendly environments that are free from ageism. Thank you, and I will turn it back.
Great, thank you. We're now going to begin with rounds of questions, beginning with Ms. Falk, please, for 6 minutes.
Thank you so much, Chair, and I'd like to thank both of our witnesses for your time today and for contributing your expertise to our study. And special thanks to you, Dr. Boskart, for your continued commitment to care for our seniors on the front lines throughout this pandemic. Tragically, long-term care has been the epicenter of the pandemic. While the problems in long-term care aren't new, we know they're not new. They have been highlighted and heightened during this health crisis. So we know the delivery of quality of care for our seniors depends on a skilled workforce. And so, Dr. Boskart, in your report, you co-authored Restoring Trust, COVID-19 and the Future of Long-Term Care. It suggests that the priority in addressing long-term care should be to solve the workforce crisis. In fact, it says if we do nothing else, we need to address staffing. That report was released in the first wave of COVID, so a few waves ago. Would you say that it is still accurate to prioritize the workforce crisis in long-term care? And could you also share with this committee in more detail the existing challenges in long-term care workforce?
Yes, absolutely. And thank you, Ms. Falk, for that question. First of all, I wanted to accept your thank you. It's a privilege for me to give care to our seniors, and it brings much happiness to myself and many others. So I see it as a great contribution to our country, to which I am an immigrant, and I feel very fortunate to be able to provide care to its elders. From a long-term care perspective, indeed, staffing is a major challenge, and it has not gotten any better. In addition to the fact that we have had many nurses and personal support workers or unregulated care providers and others gone through not one or two COVID tests themselves, and I was one of them. A lot of us have gotten sick, and in addition to that, a lot of us have not been able to carry on with double shifts and continuous work. And so many of my colleagues have worked nonstop since the onset of COVID, and at times that starts to weigh in. And so we are losing the staffing just because they are burned out. So in addition to that, we also know, and I think my colleague alluded to that, is that we work with a workforce in long-term care that is mainly female. The majority of them are unregulated. And we know that those groups of people come from the cohorts or the environments that sometimes struggle with life. Many of them are immigrants. Many of them hold more than one job in order to pay the bills. They cannot take a full-time job in one long-term care home because there is no full-time jobs available. There is full-time work, but there is no positions available. As a result, they do not have sick leave or benefit plans or a pension for that matter. And they really have to take more than one position in order to meet the ends. That really have to rush from one place to another and are not committed to one specific home. And that leads to discontinuation of care, and that always affects the resident and the family negatively. So that is one very big problem that we have. In addition to that, we also have, moving into COVID, we had serious shortages of staff in long-term care. Found that even if nursing homes staffed best of their ability with all positions filled, we still would only give 60% of the care that was required to provide quality care. Canada has the lowest staffing recommendations across all of our Western countries in mandatory staffing for long-term care homes. As of today, we are short about 60% of registered nurses in long-term care, 50% of registered practical nurses, and about 20% of personal support workers. And so it is impossible to provide care if you do not have the people to provide the care. So that's a very short first main problem I see happening in long-term care. It's very difficult to attract my colleagues to long-term care if I cannot guarantee full-time permanent jobs with a pension plan, sick leave, or anything else, and where you always will work a double shift. It's very hard to do.
Dr. Porter, do you have anything that you'd like to add to that as well?
Well, I would say that the situation is quite similar in Manitoba to what has been described for happening in Ontario. And yes, this issue of part-time work, not being paid well, these are clearly not going to entice individuals to come to these positions, particularly not after everything we've seen during the pandemic, how long-term care facilities have kind of been left on their own to fend for themselves and their residents. So a lot more needs to be done in this regard in terms of ensuring that we have sufficient funding levels to provide the compensation. And this is something that's clearly identified in the WHO report, that this is an issue across all of long-term care, and also would apply to home care as well, that people are just not being paid well enough for the important and work that they do.
So what would either of you say is the greatest barrier to recruitment then? If out of everything that was said or listed, what would be the greatest barrier to that recruitment or retention of staff?
Very briefly, please.
Pay.
Oh, that was very succinct. Thank you.
Thank you.
Thank you, Ms. Falk. Next, we're going to go to Ms. Young, please, for 6 minutes.
Thank you very much, Mr. Chair, and thank you to our witnesses. Oh, sorry, I forgot to do this because I haven't got the right microphone. Sorry about that. Thank you very much to the witnesses for being here today. Very interesting discussion about, of course, the challenge of retaining nurses. 16% of nurses have said that they'll leave their jobs in the next year, and only a quarter took time off to look after themselves. And I think this speaks to the obvious issue that we have. And you mentioned about the excessive shift work that many nurses are taking. And Dr. Boskart, if I could ask you if you have any indication of whether that would be more acute in private versus nonprofit homes.
The answer is probably not. My colleague, Dr. Andrew Costa, conducted a study to look at care levels and to look at some of the different quality aspects of care in private and not-for-profit home care nursing homes, and found that it's very, very similar. It's very difficult to attract staff to these environments, and the ones that you have often feel that they're not well prepared. Hence, the challenge we have in our educational system to prepare nurses better for what's to come, and then providing them with strong orientation so they remain on the job.
So it's not only pay, it's teaching. It's making sure that they have the skills that they need.
Yes, we've looking across Canada when we do a scan of all nurses, and this is very specific for the Bachelor of Nursing, the registered nurses. We've looked at their content and their curriculum, and I'm very happy to see there is still maternal child education in there, and trying to teach nurses how to help moms to breastfeed, which is absolutely necessary. 90% of the people in our hospitals and nursing homes are over 85, and so they receive additional care. Gerontology is not a mandatory component in our nursing curriculum in Canada, nor is it a specialism, or is it something that people get paid for if they have an additional certification. And so I know my colleague, Dr. Porter, has been a long-standing advocate at the Canadian Association of Gerontology to really look at really enhancing the skills of those in those environments. And so if we do not prepare specialists, how do we provide excellent care?
Dr. Porter, could you comment on that?
Well, just to add to what's been said about the lack of gerontology or geriatric education, I think you will see that this exists in other professions as well, even though they might end up serving primarily an older audience. So, even pharmacy programs, rehab programs, many programs out there do not necessarily have that specific training for older people. And I think this committee already heard about the lack of geriatricians in this country as compared to pediatricians. And so it certainly is an issue. It is challenging, I would say, at the university level. When young students are coming in, they're not necessarily anticipating that they're going to work with older people. And that's across all healthcare professions, but it is certainly something that most are going to end up working with older people. And so we really need to ensure that there are positions out there for people and that they're well paid, as we've already discussed, but we ensure that that gets put into the curriculum of various healthcare programs, that it's in case studies, some of the interprofessional education that goes on, so that teams of healthcare professionals are able to appropriately serve older people in the community.
You also, Dr. Porter, mentioned transportation, and you said that if aging in place is our goal, and a lot of people now are questioning whether they'd ever want to end up in a long-term care facility, age-friendly communities are important. What would you think that we should do as a federal government to further that goal?
Well, the federal government is overseeing the age-friendly communities initiatives across the country, although, of course, there's a large provincial jurisdiction over many of these services, which does include transportation. So I'm not exactly sure what the role of federal government is, and this is one of the issues that involved with transportation, which includes municipalities. So municipalities really need support in providing these services, whether they're rural or urban communities. And, it just is not a great scenario to suggest. And we see these stories in the paper where people are not able to get to vaccinations, which, is the main healthcare issue right now. And so we've been doing some projects right now in Manitoba, and we did get some funding for that, but it all came about a little bit too late. So I think just in general within healthcare, there's a concept of, we'll just hope that we'll set up the appointments and we'll just hope that somehow the people figure out how to get here. But we've heard over and over again when we've done consultations across the province that transportation is a huge barrier for people getting services and just being able to engage in their communities, but in particular with healthcare.
Thank you, Ms. Young.
Thank you. Thank you very much.
Madame Chabot, s'il vous plaît.
Madame Chabot, please. You have 6 minutes. Thank you, Chair, and thank you very much to our two witnesses for what you've been sharing with us today. I agree with you on many aspects, as I'm a nurse myself by profession in another life. The reality that you have laid out in terms of the working conditions and the pay and the fact that it's hard to attract and retain people, I think is a reality that we find in all provinces. But in Quebec, we are quite proud of what's taken place. We know that at the height of the crisis, there were 10,000 personal support workers that were recruited that are now part of the care teams. And there are provincial labour laws that apply, so we were able to increase the pay. So that leads me to put a question to you. When it comes to Quebec and the other provinces, we've asked for more support for their social and health services because the provinces have the jurisdiction in terms of providing the services and organising care, and also in terms of labour laws and regulations. And we have asked, therefore, for significant increases to be made to health transfers because we know that health expenditure, basically 80% of that is taken up by workers, and we need workers to come. So do you agree with this idea that the federal government needs to make these transfers of amounts to the provinces that are necessary for healthcare?
Madame Porter.
Madame Porter, what do you think about the health transfers?
Well, certainly I think that there's more funding is absolutely required across the board. I'm not sure that I'm going to get into which jurisdiction requires to be providing those funds. We're all as individuals taxpayers, and the money has to come somewhere. But certainly we're going to need to see more funding in the system. In addition to the things we've already talked about, we also know that there there have been many surgeries that have been delayed. And so there's a lot of older people that need those surgeries going forward, whether it's for cataracts or knee replacements, and even more dire situations right here in Manitoba in terms of heart surgeries, and of course with long-term care as well. And I mentioned the therapies that are not necessarily available to people that can't afford to pay, say, for physical therapy to recover from COVID, for example. So certainly there is a lot more funding needed within the healthcare system going forward.
Madame Porter,
Ms. Porter, based on your experience, because I know they've done lots of studies on this amongst seniors. If I talk about the 65 to 85-year-olds, according to your experience, are there extra costs related to diseases that can be in a factor in terms of the increase in stress and anxiety amongst this age group?
Sorry, that was directed to me?
Yes.
Oui.
Okay. Yes, so your question was around whether this whole situation has created more problems in terms of anxiety and mental health. And yes, certainly, I wouldn't say that's across the board. I think it's a bit of a stereotype to think that all older people have fared poorly during the pandemic. I think we have some very resilient older people who have actually done quite well during this. They've had life experience. They've gone through potentially scenarios like this. I know a 96-year-old woman, and she's, not happy with the situation as it has been, but she's, been quite resilient. She's had a lot of struggles in her life. But certainly there are older people that have suffered, particularly those that are on low incomes, that are disconnected from their communities, that are living in apartment buildings. They don't feel safe even leaving their rooms. And so, yes, certainly dealing with the mental health challenges that the pandemic has posed will be a reality going forward as well.
Justement sur la question.
So on this question of housing now, Ms. Porter again, when it comes to 65 to 74-year-olds that spend more than 30% of their income on housing, do you think?
There certainly are people at the low income scale that they certainly need more support. So anytime programs are being designed for older people, I think it would make a lot of sense for those programs to be targeted to those who are in great need. Again, there's a lot of heterogeneity in the older population in terms of their financial circumstances. And so there are many older people in that age bracket who are still working, for example, who are still paying taxes. But there are people that are younger, particularly people that might have faced lifelong health challenges and things that are not able to work, who are in that lower age bracket, who might not be very financially well off.
Thank you, Dr. Porter. Merci, Madame Chabot. Next, Ms. Gazan, please, for 6 minutes.
Thank you so much, Chair. And my first question is for Dr. Porter. I'm sure you would agree that the treatment of seniors during the pandemic has been pretty horrible and less than adequate. And much of this has had to do with the poor conditions in long-term care centers and generally inadequate programs and systems for seniors. I would argue this is a clear indication of an issue of ageism that we certainly have in this country. And I think it's important that we root these issues out to ensure that all seniors can live with dignity and security. Can you tell us more about the role of ageism in the pandemic and how you would suggest creating societies and systems that didn't perpetuate ageism?
Okay, that's a big topic, but important topic. I think we saw right from the very beginning of the pandemic that ageism was seeping in, even by people who weren't likely intending to be ageist. But even at the very beginning, when we heard messages like, oh, it's not that serious because it only affects older people. So there we see the seeping in right away at the beginning that it really isn't that concerning because it's not affecting everyone in society. So we all implicitly are, we might not realize it even gerontologists, we can see it surfacing on occasions that we have this differential thinking about people by their age. And this is something that is pervasive in society. So it's not something that's going to be easily overcome. But I think you're correct in your assertion that the fact that long-term care did not do well, I think there's certainly an aspect of ageism and ableism that existed, and which was why they were kind of left on their own to try and fend for themselves. I think we have to have an awareness campaign to begin with that this even is an issue, because most people in society, they realize that there's many forms of discrimination and they realize the harms from those forms of discrimination, but they do not understand ageist as a society. And it also has implications for work. And we've seen that in many instances, older people might have lost jobs through the pandemic, and older people will likely have a harder time being hired again because ageism is also pervasive in hiring, training, even in firing employees. So it is a huge issue for our society, and I think it would be worthwhile for Canada as a country to join the WHO in combating ageism. And I understand that the National Seniors Council has this as one of its target areas, but I don't think we can underestimate how important this is. I think it also affects our students at the university and the topics that they choose to study, because it is not seen as necessarily a good role to be in terms of looking after older people. And so I think across the board, we have to try and overcome this.
So just another question. So as we know, during the pandemic, there's been certain groups hit harder, and it certainly has shone a light on racial, gender, class, and other inequalities that we have in society. These societal inequalities have been certainly had lethal consequences for groups forced to live in poverty and in vulnerable situations. And at the same time, I would argue the wealthy, many people profiteering off the pandemic and getting richer. I've taken great offense to it. Can you tell us about the pandemic's uneven effects across all social groups among seniors?
Well, I don't have a lot of specific data that I can cite, but certainly we've seen in Winnipeg where there's lots of individuals who have food insecurity issues. Emergency kits are right now in this third wave that we're experiencing. They're having to be provided with those kits. Whereas, as I said, I hear about other older people and, they're financially stable. And so they're able to weather this quite well. People are taking up new hobbies. So there is a great range of effects of this pandemic on older people. I think there's a tendency to think of them as one group and having one effect, but certainly through the various community organizations that are operating within our communities, we hear about these divides, and even just by the fact of where people are living, the physical buildings in which they live. If you're living in a house, you have a much better quality of life, most likely, because you're able to come and go potentially without any fear that you're going to have a possibility of contracting the virus,
sorry, just because I have 1 second, would you say that it's difficult to give that assessment because there's really been no race-based data and gender analysis during the pandemic to give a clear response to that, and it's needed?
Yes, in a lot of aspects of the data, at least that we're receiving here in Manitoba, which is, I'm assuming, filtering through federally, is that we might have race-based data, we might have age-based data, but we don't have a lot of the more fine-tuned data across all individuals. And hopefully we'll be able to see that as researchers and people will be able to study it.
Thank you so much.
Thank you for that. Mr. Tucker, please, for 5 minutes.
Thank you, Chair, and I'd like to thank the witnesses for their presentation and being here today and the good work that you're doing to understand what we're facing with such an important segment of our population. I'd like to talk about a little bit of, we touched on aging in place and aging at home or living at home. And I guess just to start off, I believe that after this, once we're on the other side of COVID-19, there's going to be even a larger percent of seniors that aren't going to want to move into seniors housing. They are going to want to age in place. As much as I think there was probably a large demand before the pandemic, I think there's going to be afterwards some of the lingering effects and the fear factors that is going to creep into it. So just briefly, do you believe that that trend is accurate, that it's going to happen after?
I can answer that if you like. Yes, I absolutely think that just generationally in part. So I think as we see the age cohorts changing, their lifestyles have been very different, I think, from that perspective, even pre-pandemic. But I think, yes, in terms of even families and what families encourage older people to do in terms of their living environments, clearly that's going to have been affected by the pandemic. And absolutely, we hear in our studies when people are talking about long-term care, yes, there absolutely is even more fear than there was in the past. And so there are going to be people that want to live in their own homes, live in their own neighborhoods. And we need to really make sure that we are not just replacing long-term care living with caregivers becoming overburdened and them having to take everything on. And so we really need to make sure that we have more home care available, as well as a lot more community supports. And there's a lot more than just transportation, but that's one that sometimes gets forgotten, because when we say age in place, I think people think that the person's never going to leave that place. But there are many reasons why people want and need to leave the place that they're actually living in.
Thank you for that. There's one of the concerns that I have is what does Canada look like after this? And I guess I'll carry on with Ms. Porter. You brought up the delayed surgical care, and just in general, healthcare has been delayed for the last 16 months in so many cases. And I'm very fearful of the state of finances in provincial capitals across Canada. There's record amount of debt, and the ability for provinces to provide health care going into the future is going to be very challenging. So if there's going to be decisions to be made provincially, I'm concerned about the financial strength of the provinces to meet that challenge. And I'm just wondering if you have any idea if there's one segment of delayed care that is going to be the one that we should be watching afterwards for seniors.
Oh my goodness. So in terms of surgeries or therapies, I mean,
Yes.
I think there's a whole host. I mean, I think if we think from a primary prevention point of view, that was what I was kind of trying to get out in my original statement around the physical therapies and exercise programming. I come from that background in kinesiology, and it is a primary prevention means for so many different health conditions. But as I mentioned, many older people live in apartment buildings. They have barely moved at all through these various waves of the pandemic. And so I think a good place for some money to be spent is on primary prevention, for preventing falls, for making sure metabolic health is good. And so that would be where I would put some money after this pandemic or going out of this pandemic.
That's on the chronic side? the chronic side, but there's going to be emergency needs, and I'm just wondering if there's any statistic. Like there's different. I won't say that it's from a reliable source, but there is concerns about delayed cancer diagnosis, and we know that the health outcome of the patient is going to be delayed on diagnosis is going to be a poorer outcome. So there's cancer, there's hypertension that is a ticking time bomb out there that I don't think it is kind of related to the inactivity of some of our seniors. But if there's no research that you know of, or no statistics on what are we looking at afterwards.
Short answer.
In terms of one specific medical condition, no. I mean, I think it goes across all the cardiovascular, diabetes, cancer, et cetera. I would imagine there's issues with all of them.
Thank you, Dr. Porter. Thank you, Mr. Tucker. Next, Mr. Long, please, for 5 minutes.
Thank you, Chair, and good afternoon to my colleagues. And thank you so much to our witnesses this after. And again, your advocacy is very much appreciated. I wanted to touch on isolation, mental health for seniors. And certainly, as politicians, join campaigns, we all go door to door and we have one-on-one direct conversations. And I would say without question, the most, shaken I was and concerned I was when I would leave the doors of seniors who were alone, who were isolated. And certainly, as a government, we came forth with some things very quick. The GIS for low-income single seniors raised that, and lowered the age of eligibility from 67 to 65, and we're going to now raise the old age pension 75 and up by 10%. But with respect to COVID, I mean, the pandemic itself has created challenges and exposed increased levels of need for direct government support during crisis. I mean, for all Canadians, but especially seniors. And, we want to make sure and recognize the importance of ensuring that seniors are equipped with the mental health supports to combat social isolation of being away from family and loved ones. So can you both, we'll start with you, Ms. Boskart, can you touch on, the issues that have become more pronounced due to the COVID-19 pandemic with respect to mental health and isolation for seniors?
Yeah, absolutely. And I think one of the things I think we'll see come out loud and clear after doors open again and people dementia. I think a lot of that has been hidden. In addition to all of the delayed surgeries that need to happen, I think we'll find a lot of people that now have advanced in their dementia journey a lot faster than we expected. And none of those diagnoses or treatment has started in a year and a half right now. So I do think that will be a significant problem. And in building on Dr. Porter's answers is, I think, two things that really require our close attention and hopefully investment is day programming within the community in an equitable, accessible approach where people that live by themselves in the community or with care providers can actually have meaningful activities, not only just for the senior and especially those for seniors that live with dementia, but it's also to help the care partner or the family member cope with everything that's going on. We are expecting that all of these people are going back to work and their loved ones, older loved ones, might have developed a dementia. We know those numbers are skyrocketing, probably to be a lot higher than we think they are, 1 in 10 by 2036. All of those people will have to be left alone and people will have to go back to work.
Yeah, fair. And thank you for that. Ms. Porter, do you have any? Oh, sorry. Sorry.
No problem. The second component that Ms. Porter can talk more about that is to really get serious about providing financial and mental and health support for the caregivers. They provide the majority of care in our communities, and in order for them to balance everything out, they will need support. So I'll pass it over to you.
Ms. Porter, can you give me some comments on that, please?
Absolutely. We certainly hear all the time about how burdened caregivers are. And when we've done consultations around the province of Manitoba, we certainly heard that there's a lot of need for respite care. There just isn't enough respite care, and one can only imagine how challenging that has been because respite programs were closed during the pandemic. So, in looking at the Canadian Longitudinal Study on Aging, some of their data and some of the anxiety and mental health issues, it was actually some of the younger seniors who were experiencing some of the larger challenges, and part of that might be because of caregiving issues. And so, yes, caregiving is a huge issue. And so this whole aging in place, you can't just be thinking about the person, the older person. We have to do more to be thinking about the caregivers and coming up with inventive ways that others can help. We're starting to try and find a home sharing program where we can have students living with older people in their own homes and taking some of the pressure off of caregivers, not by replacing home care, not by replacing caregivers, but providing caregivers with some peace of mind that there's someone in the home that can be helping the person and that they have someone that they can be talking to on a regular basis.
Yeah. Okay,
thank you, Mr. Long.
Thank
you,
Chair.
Dr. Porter. Suite Madame Chabot pour 2 minutes et demie, s'il vous plaît.
Now 2 minutes, 2.5 minutes for Ms. Chabot. I've got a question for Dr. Porter. Thank you once again. I found it very interesting that you've said that seniors don't all have the same homogeneous reality. So basically, that means that a 68-year-old senior, for example, or a 73-year-old senior may be living out different experiences. Same thing with someone who's 77. So do you agree with me then? In terms of financial health now, you've said that there's various age strata where we can draw certain conclusions. In terms of financial security, there are several statistics that say that certain seniors decide to work after 65 up until 74 years of age. And often they do that because they don't have a choice and their income is too low. Do you agree with that? Do you have statistics to share with us on that?
I don't have any specific numbers, but I know that the older person above 65, that the number who are continuing to work is growing. So that's a growing segment of the population who is deciding to continue to work. And yes, there are financial reasons for that, but there's a lot of people that do it because they find it very satisfying. It provides a lot of meaning to their life. And so they want to continue to work. There was just an article about a 95-year-old lawyer. And so people are continuing to work. Unfortunately, due to the pandemic, I think we're going to see some people who are going to have to continue to work longer, particularly those who have put money, say, into their small businesses to keep things going, and they've taken from their retirement fund. So I think there will be a phenomena of people working longer in the future.
Do you think that when it comes to family caregivers, we can see that in our public institutions for old people and at home, informal caregivers play an important role, and many people of 65 years and above are actually family caregivers. Do they have an extra financial burden because they're also an informal caregiver?
Yes, absolutely, they do. And certainly as we see more people living into their late 80s and 90s, yes, many of their children who are in their 60s and 70s are potentially still working and also caregiving for their older parent. And yes, there are certainly out-of-pocket costs associated with caregiving.
Merci, Madame Chabot. And Dr. Porter, next Ms. Gazan, please, for 2.5 minutes.
Thank you so much, Chair. And my question is for Dr. Porter again. I was wondering, that you mentioned that it's the UN Decade of Healthy Aging. And you spoke briefly about the World Health Organization's Global Action Plan and Strategy on Aging and health. I was wondering if you could expand on that, because part of me feels like we, especially with, you were speaking about ableism and ageism, that we need to start looking at what's happening to seniors in this country as a very serious human rights matter that needs to be dealt with.
Absolutely. And there certainly are campaigns out there to have a UN Charter on human rights for older people. The pandemic has even bolstered the advocates for this even further, particularly given what happened in long-term care. And, Canada did endorse this Global Strategy and Action Plan, but I'm not aware that we actually have a full-fledged plan for what Canada is going to do as a country. We see some things happening, as I mentioned, with the National Seniors Council around ageism, but there are other aspects of how we should be shifting our healthcare system as well, not focusing so much on acute demands and having all of our resources put into hospitals, but thinking about the chronic demands and ensuring that people have good functional ability, which is what the definition of health for the WHO is. And so we do need to have a concerted action through the federal government as well as all of the provincial governments, because of course there are many things that cross jurisdictions, and municipalities, they are very involved because age-friendly environments is a big part of this as well, making sure that our environments enable people to age well and to contribute still to their communities, because we have many older people who make great contributions. And one of the things that was a surprise, I think, to many with the pandemic is that older people weren't able to volunteer anymore. And some organizations like food banks relied on older people to be the ones to keep those food banks going. So there's lots of ways that we can work towards this decade of healthy aging as a country.
Thank you,
Yes.
Ms. Gazan, and
Thank you so much.
Dr. Porter. And Dr. Boscard, I want to thank you very much for the work that you do, your expertise in working with seniors, and for being with us to share some snippets of that expertise today. It is extremely interesting and of great value to our study. So. Thanks again for being with us. We have another panel joining us shortly. We're going to suspend for 2 minutes while we do a sound check for them. And again, thank you for being with us, and we wish you a good day.
Thank you.
Today's meeting is on the study of the impact of the COVID-19 pandemic on seniors. I'd like to make a few comments for the benefit of witnesses. Before speaking, please wait until I recognize you by name. When you're ready to speak, you can click on the microphone icon to activate your mic. Interpretation is available in this video conference. You have the choice at the bottom of your screen of either Floor, English, or French. Les services d'interprétation.
The interpretation services are offered for this video conference at the bottom of your screen, and you can choose either Floor, English, or French. And when you speak, please speak slowly and clearly. When you're not speaking, please put your mic on mute. And now I would like to welcome our witnesses to continue our discussion with 5 minutes of opening remarks, followed by questions. And today with us, we've got the Coalition for the Dignity of Seniors. We've got Lise Lapointe, who is member and chair of the Association of Retirees from Education and Other Public Services in Quebec. Then we have Pierre Lynch, who's member and president of the Quebec Association for the Defence of the Rights of Retirees and Pre-Retirees, and also Rose-Marie Tony, who is member and chair of the Quebec Association of Retirees from the public and parapublic sector.
Seniors Advocate of British Columbia, Isabelle McKenzie, the Seniors Advocate. Nous allons commencer par Madame Tonnet.
So we will start with Ms. Tunney for 5 minutes, please. You have the floor and welcome once again. I had not understood. You have the floor, Ms. Tunney. So good afternoon. So you've already made the introduction, so I won't do all of that again. Today I'm representing the Coalition for the Dignity of Seniors, which brings together 6 associations representing more than 150,000 seniors. My colleagues are Lise Lapointe, as you've said. She's president of the Quebec Association, and there's Caroline Choquet, who's with me, and she will be able to answer your questions. So we're here to promote the priorities that are widely agreed upon by seniors. As you know, the ravages of the pandemic have particularly affected the members of our associations. Many during this period have experienced physical and psychological health problems, but also significant financial pressure. The pandemic, combined with the lack of intervention that predates this period, has placed many seniors in a vulnerable position. The lack of health transfers to the provinces has led to problems of underfunding of the healthcare network, and seniors' care is being impacted on a daily basis. It's obvious to the Coalition that health transfers to the provinces need to be increased in order to improve seniors' living conditions. Only 25% of the money allocated to long-term care is dedicated to home care. Only 3% of seniors in Quebec are in CHSLDs, public care homes. The other seniors are at home or are in RPA's, private senior residences. In Quebec, 18% of seniors are in residential care versus 6% in the rest of Canada. Seniors deserve more and deserve better. Seniors' mental health has also been affected by the crisis of the past year. The tragedy that took place in the CHSLDs and fears about the spread of COVID-19 have isolated the most vulnerable seniors and have led to increased anxiety-related issues. Many seniors suffer from real mental health problems, and access to services is very difficult to obtain via the public network, and it's expensive in the private sector. The financial situation of seniors is also of major concern to the Coalition. In its most recent budget, the government announced a 10% increase in old age security benefits starting in summer 2022, as well as a one-time $500 cheque for people aged 75 and over. This is too little, and it only covers a portion of vulnerable seniors. It should be noted that nearly 4 out of 10 seniors aged 65 and over have to rely on the guaranteed income supplement to actually make ends meet. These people deserve the same consideration as those aged 75 and over, and the increase being offered by the government must be extended to people aged 65 and over. A person of 65 years of age or older who only receives the old age security pension and the guaranteed income supplement ends up with an income of only $18,000, which is well below the decent income threshold. And then, of course, there are those who receive a pension plan that is not sufficient to meet all their needs. We are therefore suggesting that there should be a new financial allowance that directly targets seniors who do not receive enough income to live decently. Moreover, the Coalition is also proposing to improve the tax credit for medical expenses and to lower the eligibility threshold from 3% to 1.5% of income for the 65s and over. The government must do more to provide a decent income to seniors. The advantages of such measures would be felt across the country and would have a positive impact on both seniors' living conditions and also on the economy. The money invested by the government in improving living conditions would be thus redistributed into the Canadian economy and would promote a senior-inclusive economic recovery. As you can see, the Coalition has a guide and it offers 38 solutions, and there's a whole number of tangible, easy-to-implement proposals contained therein. Now, we're ready, and of course my colleagues especially are ready to answer your questions, and thank you very much.
Merci. Next, Ms. McKenzie, for 5 minutes, please. The floor is yours.
Thank you very much for inviting me to provide my insights on the impact of COVID-19 on seniors. And I have to tell you that in my 25 plus years of working with seniors, I can honestly say that nothing has matched this past year for both moments of breathtaking despair and also occasions of spectacular inspiration. Now, we know that the nation has been focused on seniors in long-term care, and COVID-19 has revealed for all of us to see what life can be like for some who live in nursing homes. And Canadians didn't like what they saw and very loudly told their governments we need to do better. And we are starting to see those commitments flow to long-term care from both our federal and provincial governments that signal a brighter future, hopefully. But caveat from someone who's been around for quite a while, these fiscal commitments need to be followed with expectations, and the expectations need to be able to be measured. And standards are only as good as their monitoring and enforcement. We also need to remember that the changes are not going to happen overnight. And most importantly, they're not likely to meaningfully affect those who lived in long-term care through the pandemic. And we need to take stock of both the physical and the psychological damage experienced by current residents that has come from both being terrified of a deadly virus and kept away from their family and friends and their normal routines. We know the rate of prescribing antipsychotics increased exponentially over the pandemic. Here in BC, we saw an increase of over 10% in the prescribing of antipsychotics. That is the highest annual increase we have ever seen since we've begun measuring this. And here in BC, we've wiped out all the gains of the past 10 years to reduce their use. We did that in a single year. There are also going to be emotional scars on family members that may never heal. The pain for some of these family members from the forced separation from their loved ones cannot be overstated. And we really do need to reflect on how our actions were inconsistent with our words and devalued the importance of the connections with our loved ones in the last years of our life. Perhaps most importantly, as we focus on the future of long-term care, we cannot forget that most seniors not only wish to live at home for the entirety of their life, but they do. And I'm following up on much of what Rosemary has spoken to very eloquently. Less than 20% of seniors will live in long-term care. Less than 20% of people over 85 live in long-term care in Canada. So the vast majority of frail seniors need to be supported in the community, and those living in the community were also profoundly impacted by the pandemic. The rate at which a person is likely to live alone multiplies by a factor of 4 once you reach your 80s. The important human connections that are found less at home than they are at the library, the rec center, the senior center, the bank, the grocery store. All of these were closed for long periods of time during COVID, and many struggled before COVID to be able to provide these connections. Staying at home was much more likely to mean being alone for those over 65, and it has revealed for us the importance of these community connections going forward. The virtual connections that kept many of us going proved elusive for seniors, for some seniors, for a variety of reasons. Some, it was too difficult to become tech savvy at this point in their lives in COVID, but for many, it was a cost issue. What COVID has highlighted, and Rosemary spoke to this, is how many seniors need to use their community supports because they don't have the income that they need. A third of our seniors in Canada are living on the Guaranteed Income Supplement, the GIS. For British Columbia, that means less than a minimum wage job. And they are really struggling. And I think this pandemic revealed that the $1,000 a year it costs for the internet is just too much. And so many found themselves cut off because they couldn't go to those rec centers and senior centers and get the access that they needed. As we look to the future, we need to make sure that a person who goes to long-term care only does so after all community supports have been exhausted. If we use British Columbia as an example, we have tremendous work to do. 7 out of 10 admissions to long-term care in BC were people who had no community home supports 90 days prior to their admission. We have a long, long way to go to maximizing the potential of our home support, home care program in Canada, in part because it's fragmented in our federated model of delivery and looks very different in provinces. And cost is a big factor. And we are subsidizing people in long-term care to the tune in my province of about $60,000 a year. And yet we are giving nowhere near that amount of money to assist people to live independently. And many of the costs that some of us associate not with healthcare when we're 40, 50, or
Et beaucoup de ces coûts deviennent des coûts
80s and 90s. And I'll just conclude by saying that balancing the heartache of the past year has been the brilliant display of care, compassion, and concern that Canadians have shown for seniors throughout this pandemic. We issued put up a number for people to call if they wanted to help seniors, and the website and it crashed as thousands of British Columbians came forward to help seniors, and we saw that across the country. We're not indifferent to the needs of those who are in the last years of their life, quite the opposite. And we need to find a way to harness this tremendous goodwill of Canadians to support aging with dignity. And hearings such as the ones you're holding today are an important first step. So I thank you for inviting me, and I look forward to your questions. Thank you.
Thank you, Ms. McKenzie. We're going to proceed with those questions forthwith. Beginning with Ms. Falk for 6 minutes, please.
Thank you so much, Chair, and I'd like to thank all of our witnesses for your contributions to this study and making time to come to our committee meeting today. We know that seniors living in long-term care have been at the center of the health crisis, and we know that no senior has been immune to the challenges that has been brought on by this pandemic. My first question is for the Dignity for Seniors Coalition. Your organization released 38 recommendations to ensure dignity in living for seniors. So how has COVID impacted the priorities and the needs for seniors, and would these recommendations have differed before the pandemic?
Est-ce que je peux répondre?
Could I answer? Yes, absolutely. Go ahead. Yes, the coalition has looked more at solutions in the short and medium term that would mean that our seniors would have less difficulties. But we needed to go through this sort of crisis to realise the big gaps that already existed, and where there were very few interventions in spite of all of the surveys and the research that had already shown that there were difficulties for seniors. There was abuse that was already there, organisational abuse, it would seem. But you will understand that the current problem is much bigger than we may have suspected beforehand. That is why in the coalition we've quickly worked on this to set up measures to ensure that our seniors are considered a bit more and listened to. We had to actually bring in the army to really report on these terrible situations so that we were able to get some reaction or get a true snapshot of what seniors were going through in these residential facilities, even in the senior private residences, of course, especially in the public CHSLDs. And then in terms of home support, that's what we're asking for, to have more home care, but we understand that the budget never meets people's needs, because normally we have a subsidy for an X amount, and then after a certain amount of time, that budget runs out. Needs may arise in other months, and they're not always covered. So we need to really beef up home care funding, and we have to realise that seniors have their place in society. Before the crisis, we didn't hear much about seniors in policies and politics, nor in the Quebec or federal government. We didn't hear about repairing buildings, investing more, for example, to have correct air conditioning, because, of course, there's heat waves. But that wasn't part of the discussions and the issues that were raised before the crisis. So, yes, all of this has been accentuated by the pandemic. Certain situations already existed, but unfortunately everything worsened with the pandemic. So we hope that now we will be heard federally and also in our province. But when we're talking about the federal government, we understand that the provinces in Canada could also benefit from certain measures if we realise that seniors have their position in society, and it has to be a place of choice. Thank you.
Thank you. Ms. McKenzie, I'm just wondering if you wanted to add to that from your perspective. How has seniors' priorities and needs shifted throughout the pandemic?
Well, I think it's been over a year now. I think certainly in the beginning, as you recall, there were shelter-at-home orders. And so really it was about getting groceries and medications and meals to seniors. And that sort of faded a bit as what became at the forefront was what was happening in long-term care. That became a continued focus as family members were continued to be separated from their loved ones for what will now be over a year. So that shifted as well. I do think the issues around the lack of supports in the community that were there before COVID certainly were revealed more starkly during COVID. And I think that's a theme you'll probably hear quite frequently, that these are not problems created by COVID. These were problems exposed by COVID. Most of us knew of these problems. I would say for me, what was new or underappreciated might be a better way of putting it, is the degree to which we heavily marginalize the role that family members play. And we saw that in our approach to visits in long-term care. We really have a lot of introspection and soul searching as a clinical community to do, basically we pushed families out of the way and said, let us do our job. You're a visitor. And different provinces dealt with it differently over time, but I think that's, and this issue around home care and supporting seniors at home, I think is going to become more pronounced, because although the desire was there before, I think that as we experienced COVID, there's going to be even greater desire for people to stay at home. And we need more, I think, federal level, I don't know if leadership is the right word, but enforced standards and expectations around what people receive in terms of help at home.
Okay. Thank you, Ms. Falk. Mr. Housefather pour 6 minutes, s'il vous plaît.
And now Mr. Housefather for 6 minutes. Thank you, Chair. I'd like to thank all of the witnesses for their very hard work for our seniors. That's very much appreciated.
With Ms. McKenzie, during the course of COVID, in my riding, I had numerous long-term care facilities where many people died. I had 4 facilities where over 50 people died. I walked facilities that were not only understaffed, but under-equipped. In the sense that rooms were 4 to a person, where there should not be any more than 1 or 2 in today's society. I saw very well-meaning but underpaid and understaffed nurses and PABs. And I saw families kicked out and caregivers that were meaningful and necessary to the patients kicked out, and people died not only of COVID, but of neglect. And it was a tragedy. And while this is within provincial jurisdiction, Ms. McKenzie, you talked about enforceability of national standards and how they could be made meaningful. Could you talk a little bit more about whether or not you agree that national standards are important in this case and how they could be made meaningful and enforceable? Thank you.
Thank you. Yes, I do think we need national standards. But as I said, the standards mean nothing if there's not enforcement and monitoring of those standards. So how is that meaningful? They've got to be measurable, and there need to be consequences for non-compliance. So whether that is achieved by the mechanism the federal government already uses in health transfers, so for example, surgical wait lists have to be managed a certain way, and provinces are not allowed to extra bill, for example. These would lead to financial penalties in the transfer of payments from the federal government. Those are levers that are available for the federal government to use that could push the provinces to demand better accountability from their care homes, whether they're operating them publicly or whether they've contracted with a private operator to operate them. I can't understate the importance of openness and transparency. The public wants this, they will drive this, and if it is known who's meeting standards, who's not, where the money's going, I think the job of the federal government will have the support of its citizenry.
Merci beaucoup, Madame McKenzie. Maintenant, Madame Lapointe.
Thank you, Madame McKenzie. And now, Madame Lapointe or someone else from the coalition. I understand in Quebec it's more sensitive when it comes to the question of federal standards, even if we work with the province. But as a Quebec MP, I have seen the need to have national standards in this area. So I'd like to put two questions to you. In your organisation, I've understood it's not one of your 38 priorities, but do you agree to this idea of national standards? And then number two, when it comes to the $90 million that's been promised to help with home care in the federal budget, do you think that's a good stage in terms of your priority for keeping seniors at home for as long as possible? Can I ask Pierre to answer, please, on this one? Pierre? Yes, absolutely. Well, our health care system at the moment, where for a long time we've been seeing that there's going to be over 20% of the population that will be 65 and above. And so there's lots of different health needs for seniors. Well, in fact, there's a generation of seniors, the baby boomers, who have paid the cost of this in the CHSLDs, where there have been deaths, and these deaths should not have happened if we'd been well prepared. So from a Canadian point of view, it's not just in Quebec, in fact. It's one thing to have standards, but if there's no one to actually enforce them, as has been said, then it's meaningless. And in terms of visits, I often go into the CHSLDs because I know people who are in there. And sometimes that there is a ministerial visit every 3 years. And sometimes a bit more often, but in a CHSLD, it may happen where organizations actually rent spaces because they have not got enough room in the public CHSLD, and there's just visits every 5 years. So you can have strict standards, but if there's no one to enforce them and make sure that people comply with them, it won't actually work. So the moral of this story with wave one of COVID is that our long-term care has to be ready as our short-term care. That was not the case in terms of equipment, for example, or preparation, training, and emergency measures. I saw the Canadian Army going into an old-age residence in Laval, where I live, and at one point of time, there were about 60 employees in there, and there were 40 of them that were sick with COVID. And there need to be specialists such as the Army to come in and sort things out. So it seems that we weren't ready to face up to pandemics, and it won't be the last pandemic that we'll need to deal with. This was the first one. It's been a real wake-up call, as we say in English, but at some point in time, we're going to need to be more proactive, more prepared. And now we're coming on to vaccination, but one of the major problems in Canada is that we count too much on other countries for our vaccinations, for our biotechnology developments, but at some point in time, we're going to have to rethink the way in which we actually set up our industries in Canada, and we need to encourage pharmaceutical companies to come back to Canada. Because for the moment, we really depend on vaccines coming in from abroad, and if we don't get them, then we can't vaccinate people. So at the end of the day, it's a question of being ready and think outside the box, rather than taking a conventional, traditional approach. Unfortunately, our healthcare systems are used to thinking inside the box, not outside the box. Thank you very much, Mr. Lynch and Mr. Housefather. And now, Ms. Chabot for 6 minutes, please. Thank you very much, Chair, and thank you, Ms. McKenzie. Chairman, I would like to, in particular, welcome the Coalition for Dignity for Seniors. I really want to give them a warm welcome because in Quebec, these 6 associations that are member of this coalition do a great deal of work and offer service to our Quebecers and those that they represent. So thank you for being here. I have a first question to put to those who would like to answer for the coalition. I think you've been quite clear about what the federal side of things should be doing in terms of increasing the OAS and also the guaranteed income supplement as of 65 years of age, because needs are already there as of 65 years of age. But as well as those increases, and of course we agree with that in the Bloc Québécois, but as well as those increases, how else could we directly improve the financial situation of seniors? Do you have other examples to share? Yes, I'll jump in for the coalition once again, if you allow me to do so. Now, we didn't appreciate the fact that we didn't consider the 65 and above in this most recent increase, because they have as many needs as the others. Then when it comes to other measures, I think we could have a new financial allowance to improve the situation for those who have the lowest incomes. If I look to other countries, they have seniors insurance. There's different terms that are used. But it would be a backup program that would help people that just have 18,000 per year to be able to get a more decent income. Because in general, you need between 24 and 34,000 to have a decent income after tax. It depends on which city you live. It must be worse in Vancouver and Toronto compared to Montreal. But recently here, the amounts for rentals have really drastically increased, and that really is having a big impact on seniors. So that would be one first measure that we would suggest. Then secondly, we need to increase the income tax credits for medical expenses, because for the moment, for seniors, they're the ones who are the biggest beneficiaries of healthcare. They have to take a lot of medications often. So we need to reduce the eligibility threshold, which is 3%. We want that to go down to 1.5% for 65 years and above. That would mean that that would give them some respite, and they would get quite a significant reimbursement for those people who are in the most difficult situation. Then a final measure. We've got several companies that have got individualized pension plans, but for certain reasons, sometimes these companies go bankrupt or they're insolvent. So I think there has to be a guarantee fund set up so that these people can at least recuperate part of their pension plan or fill in the gap that they would have lost when their company may have used these funds for their own survival and won't actually have considered these funds as the pension for those who've worked for those companies. So those were a few of the main points I wanted to mention. Of course, increasing the OAS for everyone. Well, there would need to be a drastic increase in a short-term period. I'm talking about a 2 to 3 year period. There needs to be this increasing curve so that we can bring people up to a decent income level to go from 18 to 20 and then 24,000 quite quickly. That would be important so that these people will have enough money, not just to pay for their rental, but be able to live decently. Thank you. Thank you very much. I have another question on health, and it's very much a hot topic in Quebec when it comes to home care now. Even before the pandemic, this was an issue of aging at home and having appropriate home care. I think this has been a demand, but we shouldn't throw out the baby with the bathwater. We've got our public facilities to welcome people who need more care. These residences will also always be necessary, but when it comes to home care, how could the federal government actually come and offer support to the provinces with home care? If I could jump in now, and I'd like to add on to what Mr. Lynch has just said. Yes, seniors have an unacceptable income level. There's many people who have complained when we heard about the measure that was announced by the federal government, and they said that it was discriminatory. Why is someone who is 65 wouldn't have the same amount and wouldn't see this substantial increase in their OAS benefits. So people have called us up, people are complaining, people are very unhappy with this situation. So I think that we need to correct that situation, remedy things. Of course, seniors don't invest in tax havens. And at the same time, when they receive something extra, then they're able to pay for certain activities that they're not able to do otherwise. And of course, there's economic spin-offs, which we often see at a local level. And I'll leave it there, but you'll understand, of course, that if there's a bit more money in your pocket from the federal government, then you'd be able to enjoy cultural activities, pay for transportation, or have a little extra in the month or in the week, something that they can't enjoy at the moment. Turning now to home care. Yes, it's true. There is room for improvement there. For example, if we had a subsidy for repairs of buildings, for places where seniors live, or to adapt homes, there is a program for someone who is handicapped or someone who has got a deteriorating physical condition to be able to make adjustments in their home. But it's very complicated to fill out this form, and you have to wait for such a long time that in the meantime people are there for 2 or 3 years waiting for this adjustment to be made in their home so that they can continue to live at home. So sometimes they then choose to go to a senior residence, private residence, or a CHSLD. So perhaps there needs to be an increase there on the federal side. Turning now to municipalities, there needs to be agreement so that, for example, transport could be free. Perhaps that would make it easy for people to go and see the doctor or to be able to go to appointments without having to rely on an informal caregiver or support person. So there's lots of different measures that we could list. And we're not talking about measures here that would lead to astronomical costs, but they would make life much easier for seniors. Thank you very much, Ms. Lapointe. And now Ms. Gazan.
Merci. Ma première question.
Thank you. My first question is for the Coalition for Dignity for Seniors.
Just learning French, but you spoke a lot about financial insecurity among seniors. And one of the things that I tried to champion after being elected is Motion 46 for a guaranteed livable income for all, in addition to current and future income supports. One of my focuses and I guess inspirations is that, much of what you said, many seniors in Canada live in poverty and current benefits or guaranteed incomes are inadequate and sink, seniors into poverty. Do you believe that a guaranteed livable income, not survival, but livable income, in addition to current and future government programs and support, is necessary to ensure that seniors can live in dignity in this country? I'll let one of you answer that. Thank you.
Pierre, peux-tu répondre?
Pierre, would you like to answer? Yes, of course. Yes, that type of program could compensate the lack of income, in particular for the most vulnerable people. We've got around 33% of people for the moment who are living with the GIS, but they need some sort of top-up. Recently, my organization did a survey amongst its members, and we noticed that within the 25,000 members, there were 4,500 who were informal caregivers. And do you see the link there? At one point in time, that means there's one person out of 5 who's supporting another senior by helping them out. And that brings about other costs. So these people need some sort of top up to their income over and above the GIS. Even if inflation is not too high, you're still losing 1 or 2% of your buying power year on year. And unfortunately, it's not this indexed increase of the public pensions and even private pensions that will actually balance all of that out. So that sort of program would be useful, but any program like that would be very welcome. So that would we increase the minimum income amount for the most vulnerable seniors and that sort of energy?
Yes, I agree. And I think we also need to start talking about, I would add the high cost of poverty. And when you don't look after seniors, with providing things like pharmacare and a good income, it impacts health and it costs in public health. So I think there's a lot of cost savings to caring for people and making sure people can live with dignity. You've written a lot about problems associated with Quebec's public long-term care centres, specifically highlighting the long wait lists that forces many seniors into private long-term care centres where there's lower standards across the board, from the working conditions to salaries. You've listed a number of required changes to make sure seniors don't have to age in fear of insecurity and lack of care. Can you tell us about what improvements to the working conditions of senior care are necessary? And as the government develops national standards for long-term care, what standards would you like to see included? Rosemary or Lise?
Lise.
Lise, please. You have to switch on your mic, Lise. Sorry about that. Yes, the standards should be Canadian-wide that are then maintained and supervised by the provinces. And these should be based on quality that we don't find at the moment. And then the working conditions for people who are working with these more vulnerable populations need to be changed. There needs to be more staff with better pay and more personal support workers, aides that would come and give some more support. And we also need to have natural caregivers, because we've seen the importance of that during the pandemic. Often they weren't allowed to visit, and this isolated old people. And I would say for family caregivers or family members, they're going through bereavement, and that's going to take several years because they were cut off from the person that they loved, the senior that you loved, and you weren't able to go to their bedside. For certain people, I would say that they haven't actually had their funeral yet, but imagine how this is going to stretch out this feeling of loss and the ensuing bereavement phase. So yes, I think that the working conditions for people who work amongst seniors in the public long-term care homes and the senior care homes and the hospitals all has to be taken into account and ensure that this works. We've given bonuses during the pandemic, but if the bonuses disappear, then once again there'll be lesser pay, and often it's not the profession that people aspire to because of the difficult working conditions. They're terrible, they're really disastrous, so people don't want to go into that milieu. So we need to recruit people, we need to train people up, and of course we need to pay these people well, and we need to have managers in each building. These managers were absent, and often that led to terrible, disastrous situations that we heard about. So that's also very important. There needs to be one responsible person in each building who can give instructions and ensure really what's happening, and also make requests when that's necessary in terms of these facilities. Thank you.
So much.
Next, Mr. Viss, please, for 5 minutes.
Thank you, Mr. Chair, and I'll just be splitting my time with MP Mazier as well. Ms. McKenzie, thank you so much for appearing before committee today, and a lot of your words as a British Columbian MP really resonated with me today. One thoughtful point that I took from your opening testimony is that you said thousands came forward to help seniors. And during our committee, we hear a lot about we talk a lot about what the government can do and how much more funding would result in better outcomes on X, Y, or Z. But we don't often talk about the role of civil society and the role that civil society can play and volunteers can play and want to play in our communities in some ways that the federal government might be able to help them. So would you have any recommendations for us about how communities can better engage civil society, those service organizations, people who want to make a difference to help seniors live their best lives, especially those who are in long-term care or not, or seniors that need assistance?
I think it starts by really understanding and respecting the contributions they can make. If you look at long-term care, we didn't value the contributions that families could make. We didn't turn to families and ask them to help us manage the care for their loved one in long-term care. We shut them out. And when we look at the community, what the pandemic has done, and I live in the part of BC where we're worried about earthquakes, is that at the end of the day, in many types of disasters, the professional help is not what is going to get you through the day and the next day. It's the neighbor across the street or in the building. But investments need to be made in promoting those relationships and enhancing those networks. We do actually, emergency preparedness for earthquakes, as an example, is something where, it ebbs and flows. We get excited about it and we focus on it, and then our attention wanes, just like, frankly, preparing for a pandemic. We get excited about it, we pay attention to it, and then our attention wanes, and suddenly we find ourselves unprepared for a pandemic. So I think we need to recognize that, there's been lots of tragedy, lots of loss.
Thank you. We're so short on time, but
okay.
Thank you so much. Over to you, Dan.
Mr. Mazier.
Thank you, Mr. Chair, and thank you, witnesses, for the great testimony, and thank you, Brad, for sharing your time. I want to bring something to your attention that I believe is important. Many seniors cannot navigate through confusing government websites, and some do not even have internet access due to rural connectivity divide and affordability concerns. Many seniors in my riding rely on physical government offices to get their support they need. However, the government closed the doors to many offices such as Service Canada. This resulted in Canadians phoning government departments and agencies such as Service Canada and the CRA to get the support they needed. An order paper question that I submitted revealed that in April 2020, there were nearly 6 million calls to Service Canada call center that were unable to even make it to the interactive voice response automated system. The Canadians who did make it through had to wait on an average of 2 hours that month. In January of this year, there were over 120,000 calls that hung up while waiting to get a hold of the pensions call center. In February, there were over 135,000, and in March, there were over 160,000 calls that had to hang up on the same pension call center. And this is for Ms. McKenzie. Do you believe that there is an issue for seniors, that this is an issue for seniors? And how do you suggest the government address these accessibility concerns?
Well, I think the issue of how seniors access services, period, is an issue. So not just the federal government, but many private companies, things are moving online. You have to get your bills electronically, et cetera. And I think that we need to understand that there's a group of people who are going to be left behind as we move toward that digital platform. And I think that we certainly saw that in COVID. If not because they can't navigate the system, it's because they don't have the internet, either because they can't afford it or it's not available. So I do think that we need to recognize that. I think that issues around overloaded call centers and waiting on the phone for long periods of time plagued everybody, not just people over 65. But I think that what's important, and I think where the federal government can play a role, is to recognize that whatever necessary services a person might need, utilities, banks, et cetera, that are federally regulated, that they ensure that the ability remains for some people to be able to make connections other than through an online connection. So whether it's, regulating that paper, totally paperless, compulsory paperless, I guess, isn't legal in federally regulated businesses would be helpful for seniors, right? They find that frustrating. And it has a whole corollary around fraud, abuse, as other people have to navigate online platforms for people. So I do think that there are certainly, when you look at seniors, proportionately, they are less likely to be tech savvy than younger generations. Whether that changes in 30 years with the tech savvy cohort becoming seniors will remain to be seen. But the 85 plus of today, yes, lots can engage in Facebook and online and all the rest of it, but many can't. And we are leaving them behind a bit.
Thank you, Ms. McKenzie. Suite, Monsieur Lauzon, pour 5 minutes, s'il vous plaît.
Merci, Monsieur le Président.
Mr. Lauzon for 5 minutes. First of all, I'd like to give heartfelt thanks to all of the witnesses today. I think we've all got the same mission. We want to be there for seniors and improve the fate of those who've built our country. So I have first question for the Coalition for the Dignity of Seniors, and perhaps specifically to Mr. Lynch. We've talked a great deal about financial health in your speech and in the questions and answers, but we haven't touched much on mental health or physical health, or we haven't touched much on isolation. You've got a great deal of experience, Mr. Lynch, with the rights of retirees and pre-retirees, so I'd like to get your opinion as to how we can combat abuse, elder abuse. We know that the majority of Canadians and Quebecers believe that the abuse of seniors is hidden, it's invisible, but in reality, in fact, elder abuse is very present. And we've seen this in the public long-term care homes, but also in daily life. It's inflicted upon them by family members or people who come to look after them. It can be physical or mental or financial elder abuse. So how can we promote safe relationships, and how can we prevent violence, including abuse towards seniors? What about the investments that we've done as a government? Has that been a good way to combat this? And what else can we do to improve the fate of seniors? Thank you for that question. I think we have to continue to have information campaigns amongst the public in general to make them aware of the importance and the prevalence of this question of elder abuse. We need to continue with that with TV campaigns or in places where people can see them. And then there's a question of education as well. We talk about generations that are going to come after us. But we have to train up and educate the next generations to come to actually respect these phenomena or be aware of what's happening. And I'd push it even further and say that in the cultural communities in Laval, there's 112 different cultural communities. So it's important for us to be able to allow that this can permeate into the different cultural communities, so that people really are aware of the impact and the significance of abuse that takes place. Often this happens within families themselves amongst seniors. So it's a question of information, situational awareness, and if we have more information, then people will be more aware of what's going on, and that means that we'll be able to reduce abuse across the board. Thank you for that answer. Now turning to Ms. McKenzie, as you've mentioned, you've talked about aging and dignity in people who want to stay at home as long as possible. During the pandemic, we've seen, and you've mentioned, that's really highlighted seniors' desire to stay at home as long as possible. And of course, that's understandable. What we've seen in the news has meant that the most vulnerable people were those that were actually in care homes. Now, we know that seniors don't always have all of the support that they need to stay at home. We've taken the initiative to invest $90 million over 3 years in this new initiative to age well at home to meet the needs of organisations. And this initiative will help them, support them with house maintenance, their lawns, or go and get their shopping for them, for example. Do you think that's a good initiative? And what else could we do? And how could we invest in our communities and our organizations to help them to age well?
So yes, I think it is a good investment. I think that if you visualize this continuum of aging, people don't start out immediately needing total help. It's an incremental process as we age. We need a little help with house, with some housekeeping, with some groceries, with some meal preparation, and then we start to need some care. And it's really at that care needing level where it is possibly going to tip over into long-term care. So when you ask what more can be done, I would say that when we're really looking at trying to ensure that people can stay at home and not go into the nursing home, yes, the independent activities of daily living, the IADLs you've described, are important. But it becomes critical to have the care, the activities of daily living as well, the bathing, the feeding, the helping to the toilet, those type medication management. And that's where we're coming up short, in part because the federated model, the federal government gives money to the provinces decide, first of all, what the province is going to cover for you. You have a hodgepodge of, some people include housekeeping, some people don't, what they charge for it. So in BC, we charge quite a bit for our public home support. So a person on $28,000 a year who needs a 1 hour daily visit is going to pay $8,000 a year for their public home support. In Alberta, it's free. In Ontario, it's free. In Quebec, it is there is a fee for it, but it's rebated a bit through income tax. Same with, I think it is Manitoba. It's all over the map. And I think there's a role for the federal government to play in saying, as a Canadian citizen, these are the services you are entitled to receive from your government at home, and this is how much you are expected to pay based on your income, and it should be the same, and it's all over the map.
Thank you very much, Ms. McKenzie. That's probably an excellent place to leave it. We have arrived at the appointed hour. Although we'd love to continue this discussion, we won't have the resources that we need to extend the meeting, so we have to wrap it up here. Really excellent and thorough discussion.
Thanks, everyone.
On apprécie beaucoup vos
We really, really appreciate your testimony and your expertise and your work in your respective provinces. So thank you very much for having been with us and for all that you've shared with us.
Much to everyone. We are now at 6:30, and so we'll have to adjourn for the day, but we are very grateful to you for your contribution to this study. Thanks to everyone. We are adjourned.